Sidi Libau Anatabua. My subtopic is symptom if you become COVID-19. Symptom of COVID-19 may appear 2 into 14 days after exposure. This time after exposure and before having symptom is called the incubation period. You can still spread COVID-19 before you have symptom. Prismatic transmission. Common signs and symptoms can include fever, cough, and tiredness. Early symptoms of COVID-19 may include a loss of taste or smell. This list is not complete. Children have similar symptoms to adults and generally have mild illness. The severity of COVID-19 symptoms can range from very mild to severe. Some people may have only a few symptoms. Some people may have no symptoms at all, but can still spread it. Some people may experience illness symptoms such as illness, shortness of breath, and pneumonia about a week after symptoms start. Some people experience COVID-19 symptoms for more than 4 weeks after they are diagnosed. Their health issues are sometimes called post-COVID-19 condition. Some children experience multi-system inflammatory syndrome, a syndrome that can affect some organ and tissue. Several weeks after having COVID-19, rarely some adults experience the syndrome too. People who are older have a highest risk of serious illness from COVID-19, and the risk increases with age. People who have existing medical conditions also may have a higher risk of serious illness. Certain medical conditions that may increase the risk of serious illness from COVID-19 include a serious heart disease, such as heart failure, coronary artery disease, or cardiomyopathy, cancer, chronic obstructive pulmonary disease, overweight, obesity or severe obesity, and high blood pressure. That's all from me. Thank you.
Okay, Assalamualaikum and greeting to the audience. My name is Aiman Hazik bin Kasum. So today I want to talk about my subtopic. My subtopic is the cause of infection COVID-19. First of all, the cause of infection COVID-19 to people is some people don't wear their mask, but some people wear it but still got infection of the virus. This is because they wear their mask properly. People infected with the virus must also wear a mask to prevent it from spreading to the other. Secondly, the cause of infection COVID-19 to people is some people don't wash their hand after touching something randomly, or they have shaken with somebody that we don't know yet the person healthy or no. They are also not using the hand sanitizer to make their hand clean. If you use the hand sanitizer, the virus will dead. If we use the hand sanitizer, it can clean our hand from the virus 99%. Other than that, don't showing after leaving the house also the cause of infection COVID-19. This might be also the reason why a lot of people had infected to the virus. But it is just not a normally shower, just to making our body wet. Absolutely, it must be taken bath cleanly using soap. Finally, don't have social distancing also the cause of infection COVID-19. This thing also one of the most cause of infected to the people. Many people got infected because of no social distancing. It may be because they really care about the distancing, especially when they go to see their friend. People got infected to the virus not just by the touch. It also can spread by the same air that we used to breathe. So that's it for me. Thank you for watching.
Hello everyone, my name is Nurfadila binti Japar. My topic is COVID-19. I will present about what are the effect COVID-19 to individual. Effect of COVID-19 to individual. People who had severe illness with COVID-19 might experience organ damage affecting the heart, kidney, skin and brain. The effect also could lead to the development of new conditions such as diabetes or heart nervous system condition. Besides that, effect COVID-19 to individual is affect our daily activity. During pandemic season, we are not allowed to have outdoor activity or the crowded area to prevent the infections of COVID-19. Our daily activities such as buying daily needs or going to working place would become more limited. Furthermore, effect COVID-19 is affect our mental health. During pandemic seasons, many people become jobless due to companies that are not afford to pay their employee wages. For instance, hotel industry are the most affected because to visit our country directly affects some company profit. This result, most of the person having depressions because loss of source of income during the pandemic COVID-19 season. Not only that, affections of being disappointed and born also among the emotional issue that an individual may face during these situations. For example, conditions such as confinement at home, change in daily routines, and lack of social or physical relationship can also create unstable emotional issue. In conclusion, we should not underestimate the effect that bring by COVID-19 as it bring a lot of unconvenient situation to us. We should obey the rules that have been set to avoid transmissions of COVID-19.
Hello to the audience, my name is Muhammad Hakimi bin Ahmad, and today my topic is impact of the society by the COVID-19. As we can know, the COVID-19 is the virus that can decrease our healthy level. So for my first point of my topic is unable to increase the income. This is all because when the COVID-19 appears, every people cannot go to outside and must staying at home. When they cannot going to outside, they cannot doing their job. And when they cannot doing their job, they unable to increase their money. And when it happen, it can make we as a people suffering because we cannot having a saving for bear our life. Okay, so for my next point to impact of the society by the COVID-19 is cannot having a freedom for going to outside. Okay, for this point, if we go outside, we can have a little bit percent for we as people to affected by the virus. When we affected by the virus, we can having ourselves a very bad fever. At this point also is the order from the Prime Minister for we as a people to stay at home for decrease the population of the affected by the virus COVID-19. Okay, so for my third point, for the impact of the society by the COVID-19 is the changing the education learning system. As we all know, the education learning system before the COVID-19 appears have doing by face-to-face, but when the COVID-19 appears, the learning education system must doing by online. Okay, for this point, the teacher and the student must doing the classes in online, and this education learning system called teaching and learning from home. The teacher and the student will using the technology for make a classes online. The technology that they using is the laptop and smartphone. Okay, that's all from me. Thank you for watching, and please like the video.
Hello, my name is Azali Anaklai. Okay, for today, I want to share about my subtopic is overcome the spread of COVID-19 in everyday life. As we know, COVID-19 infection in the Malaysia spread quickly as a result of some attitude on an individual or society who is not responsible and does not practice the COVID-19 preventive method prescribed by MySejahtera. Okay, for the firstly tip for all measure to prevent COVID-19 infection is to wash hand with a hand sanitizer to prevent obstruction of the COVID-19 virus, like example of pumping oil. After we done pumping oil at any station, make sure to wash hand with a hand sanitizer because we are not the only one pumping oil at each gas station. The second tip for way to prevent COVID-19 is to always wear a face mask while outdoor or walk. This method is not 100% effective, but it can reduce the risk of being infected with COVID-19 virus. The use of a face mask can also prevent people from being infected with any disease if we have a contagious disease such as cough. Next is social distance should be done while doing outdoor activity. Be sure about going to place or area where people are crowded, for example, shopping center, bank, and so on. If you go to the crowded place, the risk of infection is very high. The social distance to be practiced in 1 meter from each other. Travel can increase the spread of COVID-19 and put you at risk for the disease. The Ministry of Health recommends avoiding unimportant trip to many international destinations during the pandemic. It also invites the public to consider risk when it comes to domestic travel. Staying at home is the best way to protect yourself and others from COVID-19. In conclusion, we must be together in preventing the spread of COVID-19 from the spreading as it is a life-threatening viral disease. The fallback is better to prevent is from treating it. Stay, sit home, no anywhere. Stay, we take care of us. That's all from me. Thank you.